Imagine a night when the world felt thinner. The harvest is gathered, the livestock are brought in, the wind carries the smell of dying leaves, and in the flickering hush of firelight, ancient people whisper to one another, not out of superstition, but survival. Because winter was death, and death did not always stay buried. This is not just Halloween, this is the oldest human ritual of all, staring into the darkness and asking, what is coming for us? Tonight we peel back the myths of Halloween's greatest monsters and reveal the very real medical fears, neurological mysteries, and misunderstood illnesses that gave them shape. Before we meet the monsters, we must return to where fear itself was born. "2,000 years ago, the Celtic festival of Samhain marked the death of the year. To the Celts, time didn't flow, it breathed. Seasons lived and died like people, and Samhain was the night when the spirit world bled into ours. This was not a single night of costumes and candy. This was spiritual triage. The Celts believed the dead returned seeking warmth and food. Families set places at their table for lost loved ones. Bonfires were lit not to celebrate, but to cleanse, frighten, and protect. Druids read the bones of slaughtered livestock to predict the harshness of winter. Small carved turnips stared from doorsteps, grimacing, warding. People wore animal skins and smeared ash across their faces, not to entertain, but to hide from spirits who might drag them away. Centuries later, Christian missionaries could not erase Samhain, so they rebranded it All Hallows' Eve, a night of saints and souls. But folklore does not die, it sleeps. And Halloween grew into a fusion of prayer, superstition, and shadow. A doorway to the unknown, one foot in the grave, the other trembling in the living world. Now, step through that doorway, and behold what waited on the other side. Long before Bram Stoker swept Dracula into literature in 1897, Europe trembled at the thought of revenants, corpses that clawed back from the soil to feed on the living. Villagers exhumed bodies and swore they saw fresh blood at the mouth, fingernails grown long and dark, teeth sharpened and exposed, bloated red faces, groans, and whispers. These weren't lies, they were decomposition. When flesh dries, skin retracts, revealing teeth and nails. When bodies bloat, gases force blood-tinged fluids from the nose and lips. Bodies make guttural sounds as air escapes. To a terrified medieval eye, this was proof. The dead are feeding. And then we discovered an actual disease, insidious, misunderstood, and cruel. Porphyria. A rare genetic disorder disfigured its victims. Skin blistered in the sunlight. Lips and gums receded, exposing prominent teeth. Faces scarred and tightened. Urine turned red. Garlic worsened the symptoms. Patients sought darkness, lived pale, trembling, and sick. Add rabies, with its biting, sensitivity to light, hydrophobia, aggression, and delirium, and suddenly, vampire legends crystallize into medical tragedy. Official investigations throughout Europe did little to assuage fear, and if anything, grew the superstition. Villages buried their dead surrounded by traps to keep them from rising again. Some were buried face down to confuse the undead. Others were beheaded before burial. However, vampires were not undead. They were ill, and feared into myth. From ancient Greece to medieval France, legends tell of men who transformed into wolves, savage, unstoppable, cursed beneath the full moon. The Greek tale of King Lycaon, punished by Zeus for cannibalism, gave us the very word lycanthropy. Medieval Europe believed wolves were the devil's foot soldiers. Entire towns swore packs of wolfmen roamed forests, devouring livestock and children. Trials were held, confessions were forced, people were executed not for crimes, but for symptoms. Modern medicine shows the truth beneath the fur. Clinical lycanthropy is a psychiatric condition in which sufferers believe they are turning into an animal. They growl, crawl, howl, and exhibit extreme aggression. Rabies again lurks at the root, biting, foaming, and madness. Hypertrichosis, an extraordinarily rare genetic disorder, covers the body in thick hair, creating wolfmen whose existence inspired terror instead of compassion. Some historians point to ergot poisoning, the same hallucinogenic fungus implicated in witch trials. Combined with starvation, malnutrition, and wolves legitimately stalking medieval villages, the myth took hold. The beast is inside us. Werewolves weren't monsters, they were patients, feared, misunderstood, and punished. Mary Shelley didn't invent Frankenstein in imagination alone. She was watching the dawn of modern science, and the world was terrified. In the late 1700s, Luigi Galvani discovered electricity could make dead frog legs kick. Soon after, Giovanni Aldini electrified human corpses before live audiences. Executed criminals jerked upright, faces contorting, limbs spasming. The illusion of life where there was none. This was not fiction. This was live surgery on death itself. Public fascination blended with horror. Newspapers debated resurrection. Medical schools robbed graves to obtain cadavers. Doctors dissected in candlelight while mobs gathered outside, furious at the desecration of the dead. Shelley saw a world where electricity could animate muscle but not soul, where science could command flesh but not humanity. Frankenstein is not a tale about monsters. It's a warning about ambition without ethics. A medical ghost story written at the birth of modern anatomy, CPR, organ donation, and resuscitation. We do play God. We just try to do it gently now. The mummy is not a myth. It is medicine. The ancient Egyptians were not obsessed with death. They were obsessed with the continuity of the human body. They perfected anatomical preservation techniques. Evisceration and organ canoptic jars. Natron desiccation removing moisture. Resin sealing flesh from bacteria. Linen wrappings layered like sterile dressings. Amulets positioned like early biosensor charms. They practiced surgical techniques. Bone setters existed, and early prosthetics were crafted. The mummy was a patient prepared for eternity. But Europe misunderstood, then exploited. From the Middle Ages through the Victorian era, ground mummy powder called mummia was sold as medicine for bleeding, seizures, plague, and even depression. Physicians prescribed powdered corpses like aspirin. Victorians held mummy unwrapping parties, slicing linen while guests applauded. It was science theater. It was desecration disguised as discovery. The mummy's curse was never supernatural. It was history's judgment. Zombies come not from Hollywood, but from Haitian voodoo, shaped by the trauma of slavery. To the enslaved, the greatest horror was not death, it was losing agency, forced labor beyond the grave. European colonizers misunderstood voodoo as superstition, when it was complex spiritual science and cultural survival. Anthropologist Wade Davis proposed that zombification sometimes involved tetrodotoxin, the pufferfish neurotoxin capable of paralysis, slowed breathing, near-death states, brain injury from oxygen deprivation, and confusion and suggestibility upon revival. A person could be declared dead, buried shallowly, then revived, brain-damaged, terrified, traumatized, and chemically subdued by datura or other plant toxins. Modern neurology recognizes dissociative trance states, mass psychogenic illness, and trauma-induced identity breakdown, all echoed in zombie lore. Zombies were never corpses. They were human victims robbed of autonomy, identity, and dignity. A crooked nose? A strange birthmark? Knowledge of herbs? Behavior outside social norms? That could get you killed. The witch is not a supernatural villain. She is history's most tragic medical victim. Between the 14th and 18th centuries, tens of thousands of people, mostly women, were accused of witchcraft. Their symptoms often included epileptic seizures, sleep paralysis, schizophrenia, depression, autoimmune skin rashes, hallucinations from ergot fungus, midwifery knowledge, use of medicinal herbs like belladonna and mandrake. The infamous flying ointments of folklore, likely atropine-rinsed plant salves that caused vivid hallucinations. Those accused of signing pacts with devils were often experiencing real neurological illness, grief, or psychosis. Salem's young accusers may have suffered ergot poisoning, PTSD, encephalitis, or conversion disorder. Their fear spread like plague, and fear always seeks someone to burn. Witches did not curse crops. Ignorance cursed women. Ghosts linger not because they are real, but because love is. Many grieving people report seeing, hearing, or feeling the presence of the dead. Psychology recognizes this as bereavement hallucination, a comforting neurological echo. But haunting also has environmental causes. Carbon monoxide poisoning causing visions, dread, and auditory hallucinations. sleep paralysis pinning the body while shadow figures loom, infrasound vibrations below human hearing triggering anxiety and presence sensations, temporal lobe epilepsy creating intense spiritual experiences. Hauntings are not proof of afterlife. They are the mind fighting loss, oxygen deprivation, or the invisible rhythms of sound and sleep. Ghosts are love and science, braided into fear. Every creature of Halloween was a patient before it was a nightmare. A Porphyria sufferer mistaken for a vampire. A rabies victim caged as a beast. A psychiatric patient executed as a witch. A person poisoned, declared dead, and resurrected as a zombie. A medical cadaver electrified into legend. A grieving mind conjuring ghosts. And a mortal body desiccated for spectacle. These stories are not about monsters. They are about misunderstood humans in a world struggling to explain illness before medicine could. So tonight, light a candle, honor the dead, and honor the living who suffered because fear outran knowledge. And remember, curiosity is the antidote to superstition. Empathy is the cure for fear. And go ahead and have some candy. Dr. Pox's orders. Happy Halloween, my brilliant, morbid scholars. Stay curious, stay compassionate, and stay wonderfully, wickedly weird. Thanks for watching. Be sure to like, follow, subscribe, and share for more medical and science madness. This is Dr. Pox, where the truth is stranger than fiction.